Hi, and today we'll be talking about the physiological and psychological responses the body has to injury. And injury the responses can be broken down into two different categories, physiological and psychological. Physiological is to do with what happens in the body after it gets damaged. So that could be the damage response mechanism, blood clotting, hematoma, and the healing process. Because it actually deals with the body. Psychological, on the other hand, is to deal with what goes on in the brain, and how you may feel after getting injured or prior to injury, and that could be fear, depression, anger, isolation from teammate, or anxiety, just to name a few examples. And I'll be going more in depth into all these areas later on in the video, but to start off with, I'm going to look at the physiological response to damage, so the damage response mechanism. And the first thing that occurs is, of course, the injury. And naturally, the body will send all the information to the brain, and that will make sure that the body reacts correctly to make sure the injury can be dealt with as quickly as possible. And some of these things would be some of these signs and symptoms that the body is trying to heal the injury would be, of course, inflammation, which would occur to just defend the body against harmful substances and to dispose of dead or dying tissue, and it does help the formation of new tissues as well. Another thing that may occur would be pain, naturally, which is because chemicals may be released by damaged cells, which would cause the patient to feel very uncomfortable, and they could result in feeling very hurt. Now, onto swelling. This could be caused because fluid has to rush to that area, similar to inflammation, to help defend it against harmful tissue. And when this happens, this could cause this would be done by vasodilation, which can cause redness in the area because the blood vessels have to widen to allow more blood flow to reach the injury quicker. That would contain the white blood cells. And with this vasodilation and increasing blood flow would cause heat as well, and will cause the actual place where it's injured to get increasing temperature, which can help the vasodilation and the blood flow as well. And then naturally, because the injury has swollen or be inflamed, then it will cause lack of mobility, and its range of motion will decrease quite a lot. And these signs and symptoms, that's like the third stage of the damage response mechanism, and then inflammation is the last one, which is what I already explained. Moving on to blood clotting process. To begin with, of course, the injury occurs like any other injury, and the platelets are activated and they travel in the blood to the damaged area. These platelets are used normally to just begin to patch up or stop the bleeding or the puncture that may be coming out through the cup onto the surface of the skin. And they all work together to stick together to create the sort of patch for the puncture. And there are a number of clotting factors that contain fibrin that also make the patch a lot stronger. So the platelets are there to begin with, and then clotting factors and fibrin cause a fibrin clot, which allows it to become more stronger and creates a web in itself as well. And once that continues to clot, the fibrin will cause the wound to close up and bring the walls of the puncture closer together to form new skin. And then sometimes as well in that fibrin clot, red blood cells can be trapped or get caught up in it as well, but that just makes the actual clot a lot stronger than it was as well, because the more the merrier. Now looking at the healing process, this occurs after inflammation has already begun, and it starts off with the inflammation of the injury and moves on to the repair process, which occurs a few hours after injury usually, and it's done to rebuild damaged structure and healing damaged area. So it will repair. It starts to build new cells in that area that has been damaged to rebuild its structure and the healing damaged areas. And then the final stage of this would be the remodeling. Scar tissue, so that scar tissue development will initiate or imitate, the original structure prior to injury. So it will try to repair it to a point where it's almost identical to what it was before it got injured. An example of this could be, as you can see, the ankle injury. Let's say you got ligament damage. That's what it would do. It would try to remodel and imitate what the ligament used to look like by building with new tissue. After inflammation, of course, as you can see at the top. The next thing we're going to look at is another physiological response, which is hematoma. And there are two different types of hematoma. One being intermuscular hematoma and one being intramuscular hematoma. Intermuscular hematoma occurs when there's only bruising in one area. So it's normally to do with minimal injuries and just pressure that has been applied to one area, but it's only been affected in that one specific area and not spread out. As you can see in the picture, there's damage to that particular muscle, and blood flow is therefore increased as the damage response mechanism has been activated. And this bruising could be internally bleeding, but it doesn't seep into surrounding areas like intramuscular hematoma does. Now, intramuscular hematoma, on the other hand, can be quite severe, and it does spread around to the surrounding tissues. And it can be superficial or deep, and the muscles around it can be affected by bleeding that seeped into it, because it has damaged other tissues other than the ones that was originally affected, and the swelling can persist for up to 48 hours, which is quite a long time, and it does take a longer time to recover than an intermuscular hematoma injury, and it is also extreme in comparison to the intermuscular hematoma, which is very minimal and isn't that doesn't need that much attention. It's not that fatal. Now we're going to take a look at the degrees of ankle injuries. Well, not ankle, but the degrees of injuries in general to do with ligaments. So to begin with, there's 3 different degrees. There's first degree, second degree, and third degree damage. The first degree is the most minimal one, and the main characteristics of this is that there's pain or swelling, and there's little tearing of the ligaments, which it means that the recovery time is the quickest out of the 3, and the pain is the least out of the 3 as well. And it still means that the joint is still quite stable. As we can see in the image here, it has slightly been teared, slightly been shaped differently, but it's not fatal like the third degree one. Moving on to second degree, There is moderate stability at this point because a bit more tearing has occurred. And the joint is unstable. Slightly unstable, not fully unstable. And there would be severe pain and swelling, but has the broadest range of damage, so it could be very, very, very painful, and it can be a lot less painful. As you can see in this, the ligament has been, for the most part, kind of half of it has been teared, and that could be very dangerous and very painful for the client. The last one, but definitely the worst, would be the 3rd-degree injury. And not only does this affect the tissue that was originally damaged, but it does affect other tissues around it. And it, as you can see, because that ligament is popped or teared, the tissue is teared, it will make the joint very unstable, and that ligament is now ruptured, which means it's snapped completely. And this would definitely be the most painful and have the longest recovery time out of the 3 of them. Now, we're going to take a little look at the psychological responses to injury. To begin with, this is when the injury initially occurs. So an athlete like Derrick Rose, he's a Hall of Famer basketball player. He has experienced quite a lot of quite fatal and quite painful injuries, as you can see. And a lot of these responses would have affected his career as a player. He got injured, and then now he's never returned to being the same athlete. And that could be because at the point of the time he got injured, he was scared that he may not ever play again. Initially, he didn't know what to expect going into that doctor's office. And that could cause him to become quite easily depressed, especially because it's his career, especially if it's your job, or even if it's just your hobby. It's something that you always like to do. You could become very sad about not being able to play for a lot as much, and of course that can make you angry, whether you think it's your fault or someone else's fault. You may just be angry at your foot itself or the injury itself, and that could be a psychological response. And then also, if it's quite a bad injury and you're in the hospital bed all the time, it means you're isolated, and you could miss everyone, or just miss your bed, miss your own house, miss your own kitchen, whatever it may be, or even just your own teammates as well. Especially if you're very close to them and you always hang with your friends or your teammates, you could feel quite isolated in the hospital with no one there. And then lastly, anxiety as well could affect the athlete, because they would be anxious to know what actually has happened to them and what the recovery process is going to have to be. Now, some other psychological responses, this would be to rehab. This is when they're starting to heal and the doctors have already diagnosed and have begun the repair process. There's still some psychological responses that could occur, and you could find that you're a lot either more or less motivated to get back in. It could be less motivated because it's so hard, you just think it's impossible for me to get back where I was, which is quite a common one. You'll be very frustrated because certain things you could do before you can't do now, and when you're trying to do it, it may not work out for you and you get quite frustrated quite easily. You'd still be very anxious because you just don't know what the future holds. And if you can also try to use goal setting, or you may set your goal setting yourself, to try to give you something to do or feel more motivated towards to do something that could get you back to where you were before.